Good morning. I am Erin Young. I am a co-owner of Houston Birth and Baby. I'm a licensed massage therapist, a certified doula, a certified childbirth educator, a certified postpartum and infant care doula, a labor whisperer, and I am coming to you today as a licensed massage therapist to chat with you about how prenatal massage can benefit you during your pregnancy. So thank you so much for stopping in and participating in this meeting. If you give me just a second, I'm going to start sharing my screen with you, and we're going to go through some slides and talk about how pregnancy massage is beneficial for everyone in their childbearing um, time. So just give me one second here. I've got to get all my technical stuff working, and we will get started. I hope you're having a wonderful Saturday. It's beautiful here in Houston. It's sunny and bright and hot as always. So that's fun. Um, not sure who all will be joining me. So just bear with me a second. I'm trying to get all the technical stuff to work here. I'm going to start sharing my screen. All right. Welcome. Again, happy Saturday. My name is Erin Young. I'm a licensed massage therapist and co-owner of Houston Birth and Baby. So let's get started here. What is prenatal massage? Prenatal massage is similar to regular massage in the fact that it aims to relax tense muscles and ease sore muscles while improving circulation and sleep and mobility, as well as it helps to relieve anxiety and stress. But prenatal massage does differ from typical massage therapies in the fact that it's customized to the needs of the pregnant women and their changing bodies. And as a massage therapist, I make sure that when we do our initial intake, I am asking you all the important questions to figure out how to customize our session to fit your needs. I don't do cookie cutter sessions with my clients. I make sure that I'm addressing the areas of concern for you so that you can leave my space feeling relaxed and at ease and not in as much pain as you were when you came in. Swedish massage is the technique that's most common when I do a prenatal massage. It's also the most common traditional non-pregnant massage style. It's used to relax muscle tension and improve lymphatic and blood circulation with gentle to mild pressure applied to specific muscle groups. Swedish massage is the most recommended massage method during pregnancy because it works to reduce discomforts brought on by the hormone shifts that we're going through while we're pregnant. That's pretty cool, right? I think so. It's fun to know that the type of massage you're getting during pregnancy is the same massage you would get if you were not pregnant. So let's talk a bit about the benefits of prenatal massage and how it works. During the 9 months of pregnancy, of course, the body undergoes some pretty amazing changes, including the changes to your center of gravity, your abdominal muscles, your emotions, your sleep patterns. It also puts a lot of stress on your back, your neck, and your shoulders. Obviously, you're growing a human being, and there's a whole new weight shift happening in your body as well. Pregnancy hormones also relax your ligaments, which cause pelvic muscles to become weakened, so it can affect your posture due to the added weight of the body. Prenatal massage often can help manage the aches and pains experienced in pregnancy, as well as the emotional changes by doing the following things. It can reduce back pain caused by sciatica, which we'll talk about in a bit. It can reduce edema or swelling. It can improve your circulation. It can relieve headache pain. It can reduce your stress and anxiety, and it can improve your sleep patterns. So let's take a little bit of a closer look at what those things that we benefit through massage are. So sciatic pain, it's literally a pain in the butt. It's the longest, the sciatic nerve is the longest spinal nerve in the body, and that runs along both sides of the spine, from the lower back through the buttocks, down the back of the legs, and it ends in the feet. So pain in this nerve is experienced by many people in late pregnancy as the weight of the uterus increases and puts added pressure on muscles of the pelvic floor and lower back. A lot of my clients come in complaining of this specific thing. They'll say, you know, I hurt here, and they'll point to their butt and kind of point down the back of their leg. And I know then that it's sciatic pain. The pressure creating tension in the muscles of the upper and lower leg cause them to swell and put pressure on other nerves. So thankfully, prenatal massage addresses this by relieving tension to those inflamed and nearby nerves. So how do you know if what you're experiencing is sciatic nerve pain? Well, there's a couple different things that we can do to figure it out. Occasionally, you'll have constant pain on one side of your butt or your leg, and pain from the butt down the back of the thigh and to the foot. You'll get sharp shooting or burning pain in the back or the back of your legs or in your back. You'll have pins and needles, that feeling like when your foot falls asleep and it's waking up. You'll get that tingly pins and needles feeling or weakness in the leg or the foot. You might have difficulty walking, standing, or sitting. I experienced this with my second baby, and it was not fun. So I not only know how this feels personally, which benefits my practice because I can, again, treat it from a professional standpoint, knowing how it feels myself because I've experienced it. For any kind of pain or discomfort that you're experiencing, it's important to check in with your doctor or midwife to make sure that your experience is normal and not something that we need to be more concerned about. So how do I address it? Well, it depends on the severity of the pain that you're experiencing caused by the sciatic nerve pressure. It's different for every person. It's based on the amount of stress to the nerve and the varying pain thresholds that we have. But sciatic pain can also become very, very severe for some. So before beginning the massage, I will help identify your severity, the point of origin, your pain level to help determine the best individualized therapy for you. Like I said before, all of my massage sessions are unique in the fact that I want to address your specific needs, not a cookie cutter style of massage. So massage therapy will likely begin with some gentle stretching. I'll bend your knees and lift your foot and help stretch out that piriformis muscle. I'll do some muscle assessment and figure out where most of your pain is. And then we'll start the massage. The massage will focus on the piriformis and the gluteal muscle to help reduce and relax the muscles that cause the spasm and the pain. I always check in with you too to make sure that the level of firmness that I'm using in my massage is comfortable for you, so that I'm not using too much pressure or too light of pressure, and that I'm not hurting you more than I'm helping you. That's really important to me as a therapist. Pregnancy-related swelling. Did you know that during pregnancy, the body produces 50% more blood and other bodily fluids in order to meet the needs of the growing baby? This can cause swelling and edema of the ankles and hands, the legs, the feet, and the face. It's normal during pregnancy because of this added production and retention of fluids. The extra production of fluid is necessary because it helps soften the body to allow for the expansion needed as the baby develops. All of our things spread out when we're pregnant. Our muscles soften, our pelvis widens, our tissues get soft and supple to accommodate those changes. The downside of this is that swelling can be uncomfortable. For some people, fluid retention settles in the joints, and it can be exacerbated by the heat. Hello, we're in Houston. I have a lot of clients come in and complain of joint pain during pregnancy because it's so hot here. Standing for long periods of time. So depending on what your work environment looks like, if you're sedentary at a desk or if you're up moving around, that can help, or that can help me know what's causing the added swelling and the added pain in your joints. Long days of activity, whether that be, nesting and getting ready for the baby, or chasing toddlers around, or driving older children to activities, or just having a really active work life. A diet low in potassium can contribute to swelling as well. A high level of caffeine consumption. I'm very guilty of this. I love my caffeine. I love my coffee. And you don't have to give it up in pregnancy. It's suggested that you lower the intake that you are consuming, but you don't have to give it up entirely if that's not something that you're down for doing. And I totally understand if you're not. But do know that your increased caffeine consumption can contribute to swelling and joint pain as well. A high level of sodium intake, it's not good for pregnancy anyway, but lowering your sodium intake during pregnancy can help alleviate the swelling and the muscle joint pain as well. Massage can help all these things. So let's talk about how that works. Swelling or edema of the joints during pregnancy is often caused by reduced circulation in the body and increased pressure on major blood vessels due to the growing heaviness of the uterus. There's a human being in there. Everything gets heavier in pregnancy. Massage helps with this swelling by stimulating soft tissues to reduce the collection of fluids. It also works to clear the removal of waste from the lymphatic system. And I will post a link to a really great video on how lymphatic massage is done during pregnancy after this is over with. It's fantastic. Essentially, lymphatic massage is a light touch massage that helps push the lymphatic fluid out of it keeps it from collecting around the joints. So it alleviates the swelling and the pain associated with that. The transformation your body undergoes during pregnancy is remarkable. And we've already learned that one of those changes is the increased production of blood to help nourish your baby as it develops in the womb. And that increased blood flow can cause swelling or edema or even cause poor circulation. I cannot tell you how many times I've had clients come in with very swollen feet. It's uncomfortable, but it's a very common occurrence in pregnancy. This increased blood volume can cause headache and fatigue, and in some cases, more severe complications like preeclampsia, which is a dangerous rise in blood pressure, or intrauterine growth restriction, which is a condition that the baby doesn't develop properly. Maintaining healthy prenatal care while preventing complications due to poor circulation and massage is a great option for that. That is how we can combat this facilitation of proper blood flow to alleviate some of the things I just talked about. Prenatal massage is great for activating the nervous system as well, which in turn stimulates blood flow through the body. The improved circulation increases oxygen to the blood, the heart, and the arteries, which reduces the risk of swelling and edema, as well as the development of severe complications like preeclampsia or growth restriction or fetal growth abnormalities. Improved circulation also promotes cell growth. It promotes optimal organ function. It promotes stress relief. And in a bonus, it can improve the health and appearance of your skin. So you can achieve that beautiful baby glow, which we all have generally in pregnancy anyway. This just helps facilitate that beautiful glow, not the flushed and pregnant glow. There's a difference between the two. How does it help the baby? Well, let's talk a bit about that. The benefits of prenatal massage for increased circulation to the baby. Through prenatal massage, we're able to promote healthy blood flow, oxygen, and nutrients necessary to feed the baby fetal cells. This is important because the nutrients the baby receives in utero determines the physical and mental health later in life. Pretty cool, right? So how does that work? Well, in the womb, babies receive nutrients through the placenta, one of my favorite things. And we actually did a webinar on this earlier this month, which you can also find. I'll link it in the videos as well. The placenta is a temporary organ made of fluid, blood vessels, and membranes. Nutrients are received by the placenta from a mother's blood vessels and travels through the umbilical cord to the baby to feed and oxygenate the baby. Proper circulation is vital to maintain the proper balance of blood, oxygen, and nutrients for the health of the baby. So it's awesome for placental health. Who knew that, right? Headaches. Oh my goodness. Headaches are something else that's a very common complaint in pregnancy. It's really the most common that I hear, honestly, as a massage therapist and as a doula. My clients complain about headaches often. They can occur anytime during pregnancy, but most are reported during the first and third trimesters due to the increased blood production and blood flow during those times. Though there's other reasons why we get headaches as well. Not maintaining good posture, which is difficult to maintain good posture during pregnancy because as the baby grows, the weight and balance of our own body changes, and as well as the way that we sit while we're pregnant can kind of contribute to our poor posture and contribute to headaches being a common occurrence. Um, so how do we alleviate that? We make sure that we're maintaining good posture during pregnancy. Um, Shoulders up, chest out, elongate your torso, stick your belly out. Make sure that when you're sitting, you have a nice firm seat under your tush and you can lean back and have a nice firm support that supports the upright state of your spine as well. Poor posture, again, can put added pressure on blood vessels, which can reduce blood flow. And as we know, that's no good. We want increased blood flow. We don't want decreased blood flow. So just try and maintain a good, proper body posture during pregnancy. Tension headaches can also be caused by stress and anxiety that can accompany expectant mothers. If this is your first time having a baby, there's a whole world of stress and anxiety that you knew nothing about for the most part, and that can contribute to stress, obviously. If it's not your first baby, then there's a whole other side of the coin where you know what to expect, but now you have added different stresses because you might be thinking about financial situations or adjusting to life with a newborn again if you have older children, or wondering how your older children are going to accept the baby. All very common things to be concerned about as a pregnant person, and all of those things can contribute to your stress level and your anxiety level and cause tension headaches. While treating headaches with medication is fairly common, many are not recommended during pregnancy, so it's important and imperative to find natural ways to help relieve these headaches that you're experiencing. Prenatal massage can help. So let's talk a bit about how that works. Many pregnant people swear by prenatal massage. It's a great way to relieve headaches, as massage works to relieve the tension that causes many headaches. So let's find your balance. Being pregnant is an incredible experience, both during the good and not so good parts of it. For example, it's truly amazing to be able to grow and nurture your body during pregnancy, but there's also the stress of having your body shift and change to accommodate your growing baby, and that can sometimes feel like your body is no longer your own. It's okay to have these highs and lows as you are preparing for motherhood, and that too comes with anxiety and stress. While the reactions are normal, it's important to manage your stress anxiety for the sake of your health and the health of your baby. Massage therapy performed during pregnancy can help reduce anxiety and stress by helping balance the hormones associated with them. Prenatal massage affects the hormone levels that are associated with relaxation and stress. This leads to the regulation of mood, and it also helps to improve cardiovascular health. In fact, studies have shown that women who receive regular massage during pregnancy experience a decrease in the hormones norepinephrine and cortisol, which are the stress hormones, and they're associated with decreasing oxytocin and the prolactin and the other love hormones that are prevalent in pregnancy and birth. There's also increased levels of dopamine and serotonin, which help balance mood and reduce anxiety. And again, the stress hormones kind of counteract those things. So balancing them out are one of the benefits of prenatal massage. It can also help improve your sleep and reduce the risks of pregnancy complications such as low birth weight. So let's talk about how it affects your sleep. First of all, when I get you on my table as a massage therapist, I will pillow you. Pillowing you is amazing. Pillowing is a term used to describe what I'm doing with the millions of pillows that I have at my disposal when I'm doing a massage session. Once I get you pillowed on the table, your body is able to relax, and it helps facilitate turning off your fight or flight response and engaging your parasympathetic nervous system and allowing you to rest and repair. So a lot of people fall asleep on my table, and that's totally fine. I love it when you fall asleep because then I know that I'm doing my job to help you relax, and it's fabulous. Most expecting mothers plan on losing sleep once the baby arrives, but what most don't plan for is the sleep complications that occur while baby has not yet been delivered. Some people feel fine throughout their pregnancies. Many women, however, experience a lack of sleep due to discomfort, anxiety, and or anticipation. It's essential to find natural, healthy ways to get sleep, as not only are you eating for two, but you're also sleeping for two. Prenatal massage is great to create deep relaxation that is necessary for optimal sleep. So let's talk about that a little bit deeper. Um, As we learned before, prenatal massage helps reduce stress and induce relaxation, increase circulation, and soothe the aches and pains commonly associated with pregnancy. Massage also influences the production of melatonin, which is the hormone responsible for balancing the sleep cycle. There are some techniques that might be applied to help create the relaxation necessary for a good night's sleep. I use kneading and pressure on the back muscles. I massage both sides of the spine and hips. I glide across your legs and rub the muscles to alleviate stress and tension there. I knead and press the thighs. I do gliding strokes on the back of your neck and on your abdomen. It's fabulous. It's nice to have someone touching you with intention, and helping facilitate blood flow and hormone production, um, while you're being pillowed. And it's a soothing, calm, dark, relaxing, serene environment. However, not everyone has the time or the money to schedule a massage with me, and I can't show up at your house to tuck you in every night. So there's some great at-home techniques that you can have a friend or a partner perform on you before bed to help induce sleep relaxation. And I will link these in the comments as well. I just want you all to know that you don't have to come see me to get a massage, although I would love to see you. We also offer in-home massage if you're not able to get to my office here in Tomball. So that's another option for you as well. Positioning. I've already mentioned pillowing, but we're going to talk a bit more in depth about what it means to position a pregnant person on the table. Most qualified prenatal practitioners agree that the best position during massage is side lying. That is the only way that I do prenatal massage. Some massage tables, however, have a hole in the center to accommodate a pregnant stomach for face down massages, but because we're not all the same size and these table holes are not all the same size, it's not a universal fit. And also putting your client face down from a therapist standpoint puts undue stress and strain on the ligaments that attach to your uterus. So there's a possibility for excessive stretching and discomfort in that position. Additionally, lying on your back after the first trimester, like flat on your back, can cause pressure to the vena cava, a major blood vessel, which reduces blood flow to your baby. And of course, we don't want that to happen. So the safest, most comfortable way to receive a side lying massage is to lie on your side with support pillows tucked in where needed. And again, I pillow you in a specific way. I use at least 5 pillows when I get you on my table, not just 1 or 2. And I use them in a way to, again, support your body, to engage your parasympathetic nervous system and get you nice and relaxed. Yeah, that's all I have to say about that. There's more steps, of course, to comfort with the prenatal massage that don't exist with a standard massage, but the relief and relaxation you'll receive make it all worth it. So it's kind of cumbersome sometimes to get on the table and off the table and rotate from side to side, but I always do end also in a semi-reclining position. So you're almost like sitting in a recliner. It's fabulous. It's a really, really great thing. So while prenatal massage can be very beneficial, there are some circumstances when massage is not recommended or when it should first be discussed with your doctor or your midwife. women who have experienced preterm bleeding or contractions, as well as women who are diagnosed with high-risk pregnancy or pregnancy-induced hypertension or preeclampsia, previous preterm labor, severe swelling or high blood pressure. These are all things that you will need to discuss having a massage with your care provider before a massage is done. And as a massage therapist, when I do my intake with you, I do discuss these things with you, and I get a feel for where you're coming from and where your pregnancy journey has taken you and what we're dealing with. I'm not afraid to work with high risk clients. I've had many that I've worked with. I do work with clients on bed rest as well. So it's not impossible for you to receive body work if you have any of these pre-existing conditions, but we do have um, some things to discuss if we are working together, and these are things that we need to be concerned about. So, what to do when you need to find a therapist, when you need to make an appointment. Pregnant women can receive massage at any point in their pregnancy, first, second, or third trimester. I have no concerns seeing you at any stage in your pregnancy. Unlike some therapists in Houston, they do tend to not want to see clients in their first trimester due to an increased risk of miscarriage. It's important, though, that when you're seeking care from a therapist, that you choose someone who's experienced or certified or specialized in prenatal massage. This is important because not only, so licensed massage therapists do have some working knowledge on prenatal massage, but uh, therapists who are specialized or certified in prenatal massage have received training that goes above and beyond the national standards for massage therapists to address specific pregnancy and massage needs like positioning and contraindications and things like that. So a prenatal massage therapist is trained to position you safely, like I just said, preventing strain and discomfort on the uterine ligaments, as well as being able to watch for concerning symptoms. We know what's normal and what's normal with pregnancy. I'm not the only massage therapist in Houston that specializes in pregnancy massage, but through Houston Birth and Baby, I am the licensed massage therapist that does most of the pregnancy massage. My husband Owen is also now licensed in the state of Texas, and he is also working with us as a massage therapist, and he too is certified in prenatal massage therapy. I'm also a certified labor whisperer, so I have experience and knowledge that goes above and beyond the normal prenatal massage therapist standards. If you are not local to Houston, the best way to ensure that you're finding a massage professional that is qualified for the prenatal care that you need is to get recommendations from your doctor or your midwife or your doula. If you already have a massage therapist, inquire about prenatal massage with them. If they're not comfortable doing it, they will let you know, and they will probably have some referrals for you, some colleagues that they know are more well-versed in pregnancy massage. Otherwise, you can visit the American Massage Therapy Institution, the American Massage Therapy Association, or the American Massage and Bodywork Practice, I think is what they are. And they have a list of prenatal massage therapists for the most part. That is the end of this webinar. I appreciate you all so much for attending this event, and I hope that this experience has left you feeling more informed about the wonderful benefits for you and your baby during pregnancy. Again, I am offering massage therapy through Houston Birth and Baby, as well as my husband, Owen Young, and we are based here in Houston. My office is in Tomball. I'm going to turn off my screen real quick and see if I can get rid of this so you can see my face again. Maybe. Let's see here. I'm going to stop sharing my screen. There we go. Thank you all again so much for attending, and I hope that you learned a lot. And I would love for you to stay tuned to our channel to see what other offerings we have for you at Houston Birth and Baby. If you have any questions, please feel free to contact us. Hello at houstonbirthandbaby.com or 713-714-7649. And as always, thank you so much for your continued support. We really appreciate it. Have a great day. Bye-bye.